Let me welcome Dr. Anupama Gotimukla, our AAPI president.
Thank you, Dr. Chalil. And we are here to present ourselves the best CEO forum of the Global Health Summit, 15th Global Health Summit. And every word we say here is very, very precious. We thought that prevention is something we need to focus more. And we have excellent technology now.
Welcome all of you to this 15th Global Healthcare Summit CEO Forum. We've done it multiple times before. I want to thank our sponsors very well. Mr. Gaurav Agarwal, Mr. Narayan Rao Sripada, and Dr. Nias Mohammed. Thank you so much for your sponsorship. Again, we have an agenda. We have an action item after this event. You will be listening to all these leaders. But apart from that, this is not just a discussion and you walk away. We will be, again, myself, I'm Dr. Joseph Chalil. I'm a professor back in Nova Southeastern University in Florida. I chair the business school and work for the medical school there. And I've written a book which is in health policy, and next one coming out. So my passion is in preventive health because, 25 years ago, when I lived here in India, I was an MBBS student, as many of you were. And in second year MBBS, my father died of a heart attack. And if we had a preventive exam, if we knew before he was a cardiac patient, we could have saved his life. I see many patients nowadays, breast cancer, cervical cancer, diabetes, hypertension, all diagnosed very late in their cycle, so that we can't do nothing for them. When people are diagnosed with stage 4 cancer, no matter which latest center we have, it just doesn't help. We were supposed to have Professor Nalapat here, who is the vice chair of Manipal and the ex-chief editor of Sunday Guardian.
Including my very dear friend, Dr. Joseph Chalil, to speak at this 15th conference of the AAPI. This is something which the AAPI members have been doing across the United States for so many decades, and which is among the many reasons why, if I may say so, it's one of the most important reasons why there is such a warm and good feeling about India in civil society in the United States.
Thank you, everyone. Again, thanks for this opportunity to be here and to be able to address this group of partners. That's what I call it, all partners in this. Those of you who heard me speak earlier at the Women's Forum, that was directed with one goal in mind, and that was really to make improvement and continue the continuum of our movement. But here at the CEO Forum, what I want to focus on again is the theme of prevention, focusing on how we can use technology to improve that. And some things that unfortunately are happening despite what we all know as physicians and those of us who have exposure.
Although I am also from RSSDI people has talked yesterday. So I shall be representing today from American College of Physicians India chapter. And I shall be talking about how can we really work together to make the health conditions better in India.
My name is Dr. Karthik Anantharaman, and I am the Chief Operating Officer at Roche. I take this opportunity to thank Dr. Joseph Chalil, also Dr. Anupama, Dr. Rudhia for inviting me to this American Association of Physicians of Indian Origin 15th Annual Global Healthcare Summit. It's indeed a pleasure to be a part of this prestigious event. I do understand I would have loved to come there in person and present, but given the new rise in the cases during the COVID pandemic and potentially a third wave, I'm joining virtually nevertheless, but definitely really look forward to a fantastic event. I do understand the key theme for this conference is technology, telemedicine, and technology transformation in healthcare.
I think over the last 2 days, you must be seeing and hearing a lot of what can be done and what is wrong with the Indian healthcare system. For the next 3 minutes, I'm going to tell what is good about healthcare system. Because I want to be optimistic And I always like to believe, and we all should believe, that glass is half empty rather than half full.
Good evening, everybody. My great pleasure to be here among the distinguished professionals, doctors from US and many from Hyderabad and Telangana and neighboring states. I was going through the brochure and the activities. The theme is adopting a village.
Let me invite Dr. Gaurav Agarwal, and he's the Managing Director of IITPL and co-founder of Innovation Healthcare Private Limited.
A very good evening, everyone. Very good evening to all the eminent CEOs on the panel and the eminent attendees. I'm very thankful to AAPI and especially Dr. Joseph Chalil for making me a part of this elite forum.
It's great to be in Hyderabad, and Hyderabad is very close to my heart. I spent 4 years here for my undergrad, and it's really great to see a vibrant country, right? So if you look at India demographically, more than half of our population is under 30. And this is a phenomenal strength for the country, and this young population would carry us forward in next coming decades.
I'm going to start off with first also saying that I strongly support and endorse the proposed Indian Preventive Task Force with the overarching objective of bringing about a transformative change in the medical practice in India, most importantly for all Indians. This is talking about prevention for all the people, all of India.
And in the very same breath, let me congratulate every single one of you, members of AAPI, great leaders on the dais, for everything that you have done to contribute to the healthcare of the country and the world. I believe there is no time like the present when healthcare has been so much center stage. The unfortunate events of the last 2 years have made everybody sit up and think about healthcare.
I won't extend my speech too long because I think we have crossed the time. I just want to put some things into perspective. Like being a doctor, see, being in India, we have been taught PSM in our curriculum. But medical students don't take PSM as a major subject. They usually ignore it, thinking that this is something related with the rural population.
I think I feel like very privileged and honored. I think my moksha is done today, sitting beside Sangeeta Reddy and all the august body here, and all the august people in front of me, audience. And there are brains and beauty also here on the floor. So my job of trying to create global teleclinics, I've been doing telemedicine for 10 years, and people in US thought I was a nut. I wrote a huge grant trying to see how older adults can stay home, blending medicine and technology.
First of all, I would like to thank Dr. Anupama, Dr. Joseph, and Dr. Sujit for inviting me. Wonderful to listen, and it's a privilege, and I'm humbled to be alongside all of you. It's really great to hear each and every story that's coming up through this panel.
To all the dignitaries on the dais and to all the audience, a very good evening to all of you. I'm Narayan Rao. I'm the founder of Salsit Technologies Private Limited, which is a startup based in Hyderabad.
Good evening, ladies and gentlemen. I think I'm privileged to be here today amongst all of you. Special thanks to Dr. Anupama and Dr. Joseph. I'm going to very quickly share, this is a totally practitioner's approach, not from a medical faculty, but purely from a technology intervention.
And it's my great pleasure to invite all the guests so we can just give you a small token of appreciation. So I'd love to call out the names.